Hi David,
Hey,
welcome to today's conversation. So, the Singapore budget is just coming out. What do you think are the potential eventful changes that the government should be looking for changing the macro healthcare policy system from Singapore perspective?
Yeah, good question, Abhijit. I think if we think about healthcare in any developed country or any emerging country, healthcare is a real challenge for all of our governments. And I think when you have a look at what Singapore's done over the last 12 months, there's been a couple of really good policy changes that I like where they're going with. If you have a look at the change around MediShield Life, if we have a look at what they were doing with the Pioneer Generation package about caring for the older Singaporean, if we also have a look about the home palliative care financing change that they did, and lastly around the emergency care in private hospitals.
Yes.
These are some policy changes that they've made, which really it's all about making healthcare more affordable and accessible to all Singaporeans. So when I think about some of the healthcare policy changes potentially in this budget, what I would really like to see is some policy changes around how do we make integrated care real. So how do we do more outside of the hospital system and more in the community from a healthcare point of view, and what's some of the incentives that we can put in place to make that happen. But to make that happen, we do need a greater investment from the private community.
Right.
And I think it's where we're going is that healthcare is no longer affordable purely from a public sector funded system only. So we do need that private investment. I think the other piece as well is we term it around hospital productivity. How do we really challenge what we're doing within our current system? Singapore has a very proud healthcare system, and rightly so. I think where they've been on the world stage with regard to academic hospital systems, etc., world class in what they're doing. But I think like all developed countries, the healthcare system is becoming under more duress and more stress as we see ageing become more prevalent. We've got an increase in chronic disease, and we've got healthcare costs which are going upwards as well. So we need to do more with the assets and the models of care that we have. So if we term it around health productivity, I'd like to see more to really challenge what we currently do and how can we do it differently. So if we think about it through a contestability framework, do we need to provide all the services that we currently provide, or should we be looking at incentives to put those out to the private industry as well? Yeah. And I think also, how do we look at different models of care, looking at technology, mobile health? Can we use telemedicine more so that healthcare is more accessible to all Singaporeans? So I would like to really see, if possible, some policy changes around those two big areas around productivity, doing more with what we have and really challenging how much are we getting out of our current assets, and the second one being around integrated care. How do we get more private investment in and do more, just not about sickness, but more around wellness and doing more in the community as well?
Okay.
Well, I think a good question on the side of that is they're the high level macro changes. What from a fiscal point of view, would you like to see?
That's very interesting. Over the last couple of years, the government has been very focused in helping our aged population to come back and join the workforce. So because of these changing demographics, they have been encouraging the businesses to hire more of those older workforce to come back and work for them. But effectively, this will mean that the medical cost of supporting them will go up because of the rising medical costs. Now, unfortunately, under our fiscal system, we have a cap of how much of that medical cost is tax deductible, and that is around 1% of the total employee's remuneration. So which by today's standard may not be sufficient. So I am hoping that in the forthcoming budget, they'll raise the cap and probably redefine the medical expenses so that the restriction on the type of medical expenses that can qualify for deduction can be removed. So this would encourage businesses to engage the older workers much more than ever before. So that's definitely one of the changes that I'm looking for. The other one, which is more interesting, is on the space of R&D. As you know, David, that in Singapore has been offering a lot of incentives for undertaking R&D in Singapore, and particularly the pharmaceutical sector, the biotech and the medtech sectors, they have been carrying on some bit of an R&D in Singapore, and they do enjoy certain extra tax benefit out of that. For example, if they incur $100 expenditure in Singapore, they get $150 tax deduction. But if you are doing that R&D outside Singapore, you do not get that $150 tax deduction. So the point that we need to look at, because many of these pharmaceutical companies, because of the population size and because of the patient's demographics, they may be forced to do a clinical trial outside Singapore, but the resultant IP may be owned and managed and commercialized out of Singapore. So would the government consider to ensure or extending that incentive of 150% even for R&D carried out outside Singapore? So we are hoping that will be liberalized, and that will be a bold step on the part of the government. So I think those are the two things definitely we're looking for.
Great. I think in summary what we're saying with these fiscal policy changes and some of the high level policy changes around integrated care and productivity, it really gives Singapore the chance in the year of the SG50 to really become the world leaders in how we provide healthcare services.
I fully agree with you, Dave.